So, what if a single health passport could solve a crisis that affects millions of people across an entire continent? That's the powerful idea we're going to dive into today. It really all starts with a story just like this one, a mother in Ghana facing serious pregnancy complications. And her doctors are completely in the dark. Why? Because her medical records didn't travel with her. Now, this isn't some rare exception. This is a daily reality where absolutely life-saving information is trapped on paper, often hundreds of miles away, right when it's needed the most. And this isn't just an isolated incident. It's a massive systemic failure. You've got clinics that operate like islands, completely cut off from one another. Patients lose their vital records all the time. Emergency responders are basically working blind, and doctors are forced to repeat costly tests from scratch. It's a cycle of wasted resources and, tragically, poor health outcomes for everyone. So this brings us right to the heart of the matter, a continent-wide health crisis, and it's being fueled by fragmented data that puts lives at risk every single day. The best way to picture this problem is with the idea of digital islands. Just imagine thousands of clinics and hospitals, each one with its own paper files or clunky, isolated computer system. None of them can talk to each other. That's the fragmented reality of health data right now. And the consequences of having all these separate islands, they're severe. This isn't just an inconvenience, right? This fragmentation is a direct cause of medical errors, dangerous delays in care, and it's a massive drain on healthcare resources that are already stretched thin. But here's where the story takes a turn, because inside this huge challenge lies an incredible opportunity. You see, Africa isn't burdened by ancient legacy systems. And that means it's in a unique position to just leapfrog over those outdated models and build a healthcare system that's truly for the future. And the foundation for this revolution? It's already being laid. Smartphone use is just exploding across the continent. Mobile connectivity is reaching more and more places. Countries are rolling out these really progressive digital ID systems. And maybe most importantly, there's a shared goal, a political will, to finally harmonize healthcare. The timing? It couldn't be better. But here's the thing. Just throwing more tech at the problem isn't going to fix it. The real breakthrough, the game changer, requires a totally new way of thinking. It means a fundamental shift toward a single, seamless architecture that can finally unite the entire health ecosystem. So that brings us to the big question, right? What kind of system could possibly unify the health of 54 different countries? Well, the answer might be a new platform called AfriPharm Health. And listen, this isn't just another app. It's designed to be the health operating system for Africa. So at its core, it's what's called an interoperable platform. That's just a fancy way of saying it's designed to connect completely different systems. It's Web3 enabled, which really just means it uses super secure technology to put control of your own health data back in your hands. And, crucially, it's built specifically for the unique realities on the ground, whether that's a rural clinic or a huge city hospital. Okay, so how does this platform actually make your health borderless? Let's break it down. It all comes down to 4 key features. The whole system is built on these 4 pillars. They're designed to take you from just a personal identity all the way to a connected network. First up, you've got your health dashboard. That's your digital ID. Then there's the health vault, which puts you in control of your records. Then the big one, the Pan-African passport, making your health portable. And finally, integrated networks to get you connected to care. Let's take a quick look at each one. So the dashboard is your digital foundation, but it's not like static paperwork. It's a living profile with everything from your blood type and allergies to your precise location, which, by the way, can be used to send emergency services right to you. Next up is the health vault. Now, this is your entire medical history, every single test, every prescription, every scan, all encrypted and completely under your control. The days of lost paper files and doing the same tests over and over, gone. You own your data, and it's there for you wherever you are. And this is the real game changer. The Pan-African passport feature literally transforms a simple travel document into a living, breathing health record. It lets your vital health info flow seamlessly across borders, connecting with national systems in Ghana, Kenya, Zambia, you name it. This has never been done before. So, what does all this mean on a continental scale? Well, we're talking about nothing less than building the future of healthcare for an entire continent. I mean, look at the shift here. We go from the current reality of disconnected national systems and siloed data to a future built on a single cross-border infrastructure. And for patients, this is huge. It gives them true data portability for the very first time. And the impact of this is just profound. A unified system means better, more continuous care. It means fewer clinical errors, much faster emergency response times. It means we can eliminate all those redundant tests and for the first time get a clear picture of public health across the whole continent. When you boil it all down, it comes to this simple, powerful promise. Your health finally travels with you, not just between hospitals, but across borders. It means giving your doctor instant access to your full medical history, which can prevent dangerous and costly clinical errors. It means first responders showing up already knowing who you are and what you need. That enables a much faster, much more effective emergency response. And ultimately, letting your data cross borders creates a whole new reality of health without boundaries. This isn't some far-off dream. This is the future being built as we speak. So I'll leave you with this to think about. What really happens when your most vital information, your health, can finally travel with you wherever you go?